to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today in the show, we have Wendy Hind. She is a policy consultant and she wrote the KevinMD article, "Thank you, pediatric medical professionals, as we bid you fondly adieu." Wendy, welcome to the show.
Thanks. It's great to be here, Kevin.
We'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
You know, my story begins with a background in law, a background as a professor, and suddenly after we have our first child, our second child is born with this heart condition that, of course, we had never heard of, hypoplastic left heart syndrome, which when we were asked about the severity of this, the cardiologist told us it was about a 9 out of 10 on a scale of health issues. So young new parents, very afraid, entering a world that was entirely new to us, entirely foreign to us. So that's where we began with, and that was really the impetus of this article, is 20 years later, we have had a roller coaster ride, but we are eternally grateful to the medical profession. And when I say medical profession, I mean everyone involved in our son William's care, from prenatal visits all the way through to long extended hospital stays where we couldn't thank those people cleaning our room and providing us food. That's the continuum of care that I'm grateful for.
Let's get into that article, and I certainly want to hear more details about that story and your journey. So when you first received that diagnosis, and like you said, you were new parents, now what kind of support services did you have at that time, and where could you turn to for support?
That's a great question. So I think that you're brand new to that. You don't know those support systems. So it's essential that hospitals and the community of caregivers let you know what is available. And frankly, we learned along the way, and I know I'm fortunate. I am a very strong advocate for myself and for my children. And I had that ability to ask a lot of questions. Even so, there were holes, there were gaps that we just pushed continually through to find. So I can't say enough that need to make sure that people really understand that all of the services that are available. Because when you're dealing with a complex kid like William is still today, you're not just talking about going in for surgeries, which are, you know, just more than a parent can even imagine, open heart surgery or abdominal surgeries. You know, we've had experienced over 12 surgeries with William. So it's more of things of, once you leave the hospital, there's things like speech therapy, fine motor therapy, gross motor therapies. I mean, you name the therapy, we needed it, we used it. So understanding those services that are available, understanding insurance, it's such a complex world, and your world is already falling apart, or you feel that way, because the most valuable thing for every parent is their child. And when their child's health's in jeopardy, it's very, very difficult to also manage all of those other components that are needed for successful recovery and for successful entry into, whether it's school, social situations, you name it.
Can you share a little bit more about the condition that your son had, and maybe a little bit more about the medical team over the years that had been caring for him?
Yeah, so he was born, like I said, hypoplastic left heart syndrome. His left ventricle then was undeveloped. Very sadly, he went through the Norwood procedure, and very sadly, Dr. Norwood just passed away last month. Never got to meet the man, never even talked to the man, yet he is, you know, near and dear to us, like so many kids that have benefited from his breakthrough surgery. Having said that, most kids aren't as lucky or as fortunate as our son, because William is now a sophomore in college. He's thriving, he's doing well, and we are incredibly fortunate. And his team consists of everything from infectious disease to cardiologists to, of course, his thoracic surgeon to intensivist to hospitalist to, you know, the range and the spectrum of specialists is mind-blowing. And what's critical, and that is often is difficult, I know, for hospitals to do, but they've really got to work at, is when you have a complex kid, that that those specialists are working as a team,
Mm-hmm.
because that body is a system, and so having a team in place is so critical to their success and their health. And then once you get out of the hospital environment, that team of teachers, that team of counselors and support specialists maybe in the mental health area and the education setting are equally important for the child's success.
I think what you said was so right. It's so important for healthcare clinicians to work as a team, because we're also siloed. We're also specialized. We have your generalists, and then you have your proceduralists, and then you have your specialists. And it's important to have that team first aspect that's often lost today. So share a little bit detail. How did your medical team work together? How did it communicate? And was there any one person that was leading the team that was comprised of so many different specialists?
To be honest, it really took a lot of advocacy on our part. I know there were people getting together, but we weren't always in the loop of that. We had a fabulous cardiologist and a fabulous general surgeon that took a keen interest in us, and we felt like all of those physicians and their team of nurses really were on our. It's important to have that feeling that someone's on your side, that someone's looking out for you, that someone's pushing for results. Because again, with complex kids, it's easy to say, well, this isn't an abdominal issue or this isn't a heart issue. So then it's kind of passed on, versus saying, you know what, when a kid's this complex, that system is connected. Mm-hmm. And so to say that it's not this, not that, can feel as a parent, it can feel a bit passing of the buck, a bit patronizing. And this is, one of my messages to get out there is listen to the parent or caregiver, because they're not here for fun. And they know you care. They know you care as a physician. So when a parent and a child come into that pediatric specialist office, that's not a well child check. So we're generally scared, we're generally frightened, and something's going on. And so what we're really after is that understanding, that really strong listening component. No, we know you're stretched for time. We know that every 15 minutes you're supposed to be in another room. But when we're in there, this is our child, this is our child's health. And we're in there because we know that something is really, really not right. So that team component, even if it's not a heart issue or it's not an abdominal issue, having that level of care to say, you know what, we're gonna figure this out, or we'll talk to other members of his team to figure this out, is really, really reassuring for parents.
You had mentioned that at points during the journey required some advocacy on your part. What did that look like? And give an example of an instance of that.
Well, again, I feel like I have this added benefit of, I was trained as an advocate, as I was trained as a lawyer. I never wanted that to be used in a way that wasn't healthy or productive for our child. I feel for parents that don't feel like they have a voice, or don't feel like they can question the authority of a physician. Because most people, and me included, we can be very intimidated by the medical professionals, because your vernacular, your whole world is completely foreign to us. And yet we're coming to you at the most vulnerable time in our life, when our health or our child's health is at risk. So it's a very difficult and power imbalance that you can feel. So knowing that you as physicians, you care, you've gone into this because you want to heal the mind and body. And if we can remember that, I think that can help us stand up for ourselves, help to push back a little bit when we're feeling like we're not getting the answers we need, or we still don't understand maybe even what you've just said. So having that power to advocate for yourself or your child in a respectful manner is just, I think, a huge benefit, not only for the patient, but also for the physician, knowing that, okay, I'm not as clear as I need to be, or we need to look further, or however that may go.
We're talking to Wendy Hind. She is a policy consultant, and she wrote the KevinMD article, "Thank you, pediatric medical professionals, as we fondly bid you adieu." Wendy, for other patients who unfortunately may be going through similar circumstances like your journey, you mentioned advocacy, of course, as one tip that you give, but are there any other tips that you could share with these other families who may be undergoing similar journeys that you've learned from your own journey?
Yeah, there's a lot of networks out there. There's a lot of blogs. There's a lot of groups that can help. There's heart, for like Heart Kids, there's lots of heart connection groups. Those can be really good places to get information, to get help, to even to just know you're not alone in this journey, because a lot of this can feel like you're very on your own, that of course your experience is unique, but just to know that it is a shared experience can be helpful. This article came because out of an impetus of we're transitioning now out of this, what I would say was a fairly safe cocoon environment where in the pediatric world, you're guided, you're ushered, you feel like you're being protected a little bit along your journey. And going now into this adult field has been a little bit daunting, a little bit scary, because we feel like we're leaving this comfort of the pediatric world behind. And now, of course, as a parent, William is needing to advocate for himself. Suddenly, legal issues come into play where I can't just call up on the phone and reorder his meds. I can't ask what the results of a test were. And yet, we all know that 18 to 22-year-olds are on a journey of growth. They're learning, but they're not there yet in terms of understanding and knowing how to take care of themselves, let alone the world of insurance. I mean, that's a whole nother podcast for us, Kevin. And so we're embarking in new territory here. And I just really wanted to make sure that the universal theme of pediatric healthcare, it wasn't just, of course it was written in my head with numerous people in mind, but it's this universal theme that I wanted out there, that I wanted to know that we're so grateful for those of you in that pediatric world who help kids and families along this very, very scary journey.
And for those clinicians on this podcast who may be listening to your story, now, what is your advice and tips that you could share with us in terms of how we can do our jobs better?
One of my biggest tips, I think, would just be remember that this is our child, this is our health. We often forget that you're going from room to room to room, because all we know is when the minute you come in our room is that it's our health at issue. And so we just really, really want to be heard. We want to be listened to. We want to make sure that you're not feeling rushed with us. I think that's very, very hard. We know the demands that are on the physicians are incredible. But for those 15 minutes, for that 30 minutes, it's important that you are in the room that you're in and listening to those people that are in there, and not because they want to be.
And if there's something that you know now that you wish you knew back before your journey started, what would that be?
I think it goes back to advocacy, Kevin. I think that, again, it is just so important that you feel empowered to advocate for yourself or your child, and to not stop when you're not getting the answers that you feel that you need, when you know in your gut, when you know intuitively that something is not right, that you don't stop. And you can do it politely, you can do it with kindness, you can do it with respect, but keep pushing if you need to. And if you're not getting answers one place, go for a second opinion, go for a third opinion. Do what you need to do.
And my final question, what's your take-home message you want to leave with the KevinMD audience?
I want to leave with, again, a huge, huge thank you to all of those physicians, all of those healthcare professionals, all those specialists, all those people that clean the rooms at children's hospitals, that provide food for us when we're in there with our children. Thank you so much for your kindness, for the love that you showed us, for caring, and for deciding that your life's work was going to be to help children and families.
Wendy, thank you so much for sharing your story, time, and insight. And thanks again for being on the show.
Thank you so much, Kevin.